With over 200 physicians and 40 specialists to choose from, the Watson Clinic has a comprehensive array of services in Polk County to treat any ailment you or your family members are likely to face in your lifetime. And one thing all women face that we often don't like to talk about: menopause. We're going there today. To put the spotlight on this often taboo topic, I'm happy to welcome Dr. Madiha Alvi. Welcome, Dr. Alvi.
Thank you.
I've already enjoyed talking with you. I mean, I feel like you've just got a great demeanor that you're like, bring the questions. We all deal with it. We don't talk about it enough. Let's first break down all those things. Even premenopause, perimenopause, I've heard it both ways. How does that transition? Talk to me, Dr. Alvi. Help.
Help is there. That's the most important thing. So I like to tell my patients about perimenopause or menopause as think of it as a life transition instead of a disease. Your hormonal seasons of your body are changing. All of us are born with a certain egg reserve, ovarian reserve, and what you experience over time is menopause, as we all know, is defined as cessation of your periods. Clinical definition is not getting a menstrual cycle for 12 months without any other medical cause. Perimenopause, unfortunately, kicks in a little earlier, anywhere from 4 to 8 years before actual menopause happens. And it is a transition because it is worse than menopause, in my opinion, because you are dealing with the fluctuation of hormones and not the steady decline or the cessation of hormones. So yes, perimenopause, that can kick in anywhere from 4 to 8 years before the actual menopause, which starts around age 51, is worse than menopause.
Oh my, I want to go on record, make a poster of that and be able to share it. I love that you say that. Not a fan to hear it's, 4 to 8 years, but you were talking about the fluctuations in hormones. I want to be curious, like you say that there's help out there. Why is it important to not just kind of, as we joked about a little bit before we started, kind of suck it up, buttercup, but talk to your doctor like you? How are you able to help?
So one of the things with endocrinology or hormones always is we have a science of testing your levels and figuring out where you are in your transition. But in perimenopause, because the hormones are fluctuating, very often, even if the levels are tested, you will be told, oh, they are in appropriate range for your age. So it's the trend of the hormones over time that determines, am I there yet? So when it comes to symptoms, they're all over the place. And we like to point our fingers to other stuff instead of pointing towards our hormones sometimes. And people refer to it as hysteria, which comes from the word hysteris, which is uterus, by the way. Oh. So that helps explain she's just going crazy. Well, she's not going crazy. It's the decline in estrogen and progesterone. So I like to divvy it up into 4 different categories. The first one is, as we all know, vasomotor symptoms, which is hot flashes, night sweats, uncomfortable sleep, mood changes, irritability, brain fog, trouble concentrating, and mood swings. The second
Did
part,
you mention mood swings?
Yes. Okay. So the second part is the metabolic syndrome of perimenopause and menopause, where because of your drop in estrogen levels, most of the body fat redistribution is happening and all of the weight sits right here.
Yeah.
So every single patient that I would see around this age group would be like, what's this? And I always say, if I have to do downward dog, you have to do a downward dog. Metabolic syndrome also comes with insulin resistance, which raises your risk for cardiometabolic disease, prediabetes, diabetes, cholesterol numbers start to go up. Then comes the musculoskeletal syndrome of perimenopause and menopause. That decline in estrogen is making you more tired, fatigued, generalized aches and pains. Frozen shoulder, I could sleep this way and now my shoulder hurts. The diagnosis of fibromyalgia peaks like in late 40s and early 50s for that same reason. So some of it is mainly the decline of estrogen throughout your body, which is driving the show. Oh, and last but not least, my favorite one, the GSM. That's the genitourinary syndrome of menopause. Because if you don't have the libido, the correct sleep, your declining estrogen levels, estrogen is the hormone that keeps your vaginal tissue moist, lubricated, and if sex starts feeling like razor burns, nobody wants it. So lots of women go through that transition, do not complain, do not bring this up, and suffer. because of it.
Well, you know, if there is one thing that I hope social networking has brought positives, my feed is full of premenopause and menopause jokes. I hope you are seeing more women talking about it. I hope that our conversation will help people realize they can talk to their doctor as well, especially when it comes to the Watson Clinic. There's their website for a location near you. Dr. Alvi, you're awesome. Thank you.
Oh, I know. Thank you.